Living with PNH, talking to your employer about the Family and Medical Leave Act, FMLA. You will see a real patient participating in 2 scenes. However, the situation has been generalized for educational purposes.
I don't need to prepare for my meeting with HR. They know that I'm sick, and they know that I'm going to need treatment every week.
I have such a busy day. I hope this next appointment is ready for the conversation.
In the first scene, look for what can be improved.
Welcome.
Thank you for seeing me.
Sure. How can I help you today?
I was diagnosed with a blood disorder called PNH, and I'll have to take some time off work for that. How does that work?
I'm so sorry to hear about your diagnosis. Have you heard of the Family Medical Leave Act, also known as FMLA?
No, I haven't.
Our company is subject to FMLA. As an employee who has worked 1,250 hours over a 12-month period, you're eligible for this accommodation.
Would I still get paid?
Our company requires that employees first use their paid leave. Under FMLA, any time taken after that would be unpaid. How much time off do you think you'll need?
I think I'm going to need about 15 weeks over the next 12 months.
Under FMLA, an employee is only entitled to 12 weeks of leave over a 12-month period. Any time after that will require special approval.
Okay, can I start my FMLA leave next week?
Under FMLA, employees are required to provide at least 30 days notice. We understand that urgent situations do occur, and we will try to work with you to ensure that you get the time off that you need for treatment, as well as to ensure that the work is organized and we can move forward. Do you need me to send a written summary of our conversation today?
No, thanks. That's okay. I'm good.
That didn't go well.
I should have done my homework.
This second scene shows how you should prepare for and discuss your FMLA leave request with your employer.
I've done my research, and I feel that I'm really well prepared for the FMLA discussion with HR for my PNH.
Welcome.
Thank you for seeing me.
Sure. How can I help you today?
I was recently diagnosed with a medical condition that will require me to take some treatments during work hours, and my understanding is that I can take FMLA leave for that. Is that accurate?
I'm so sorry to hear about your diagnosis, but yes, you're right. You are eligible for FMLA leave during this time period. As an employee who's worked at least 1,250 hours over a 12-month period, you are eligible for FMLA.
I believe I don't need to take all 12 weeks at the same time, and I can spread that out across the year?
Yes, you're right. You don't need to use it all at once. Let's say, for example, you only need 1 day of treatment a week. You may use the FMLA time as you wish until you use the allowed 12 weeks of FMLA time within the 1-year period.
My final question is, how much notice do I need to provide before I can take FMLA leave?
As you may know, under FMLA, you're required to give us at least 30 days advance notice. This will allow us time to plan for your absence and to obtain the necessary coverage. We also understand you can't always plan for every health situation. And in those instances, I ask that you work with your supervisor who may be able to accommodate a shorter period of time than the 30 days. Just also want to let you know that you may be required to provide a physician documentation confirming your need for FMLA.
This disclosure doesn't need to specify the actual condition though, right?
You're right. Physician documentation needs to confirm that your condition and treatment require FMLA leave.
Thanks.
That went much better.
And the path forward is clear. Dear Mrs. Sampson, thank you for meeting with me yesterday. I just wanted to follow up with an email detailing what we agreed upon in our meeting. Since I'm eligible for 12 weeks of unpaid leave during a 12-month period under FMLA, I will be utilizing this leave for my PNH treatment. Starting the week of November 1st, I will be taking every Thursday and Friday off for IV infusions and recovery.
As a PNH patient, it's critical to prepare before you meet with your employer about FMLA leave. The leave you need will depend on your treatment and how it affects you. Focus on good communication and documentation throughout the process, even if things change, and make sure you meet all requirements for approval. For more resources about living with PNH, visit aamds.org/living-PNH.